Hello dear friends, welcome back. Today we'll be delving into medical case studies for outpatient E&M at level 4 and 5. In my previous video, we covered a case study for outpatient E&M at level 2 and 3. If you missed that video, you can find the link in the description. So let's begin with the case study for level 4, new and established. Patient is a 65-year-old with a CHF, diabetes mellitus, and hypertension. The patient present with the leg swelling and arrhythmia that began 4 days ago. The patient indicates there is some pain in the leg and is feeling feverish. However, there is no fever on vital signs. Review system reviewed history. Physical examination is suggestive of purulent cellulitis, swelling of leg. And the final assessment and plan records from the PCC are reviewed and reveal history of MRSA. The patient indicates no allergy, a complete blood count, comprehensive metabolic panel, and a wound culture are ordered. The patient is prescribed 5 days of oral doxycycline. Adverse effects of doxycyclines are discussed with the patient. A case and the management are also discussed with the patient's PCP. Patient is returned to office in 1 week or sooner if the problem worsens. So whenever we are going to start outpatient E&M coding, we need to check the keywords in the document. So for example, say if you have take this case, so we need to look for the type of patient. So here we'll be discussing the new and established type, so we can select that CPT code series, whether it is a 99204 for the new patient and 9921 for the established patient. And the second one is problem. So here two stable chronic illness and one new problem or acute illness. And the third point is data reviewed. So as per this record, review of record is mentioned, and also the physician ordered the test, and also discussing with the patient PCP. And the fourth thing, level of risk. So here physician doing prescription management, which leads to the moderate risk. So according to the MDM table, the medical decision making for this case has now progressed to moderate level. The problem is now a single new problem that involve the discussion with another provider and review of historical record. The risk has now increased, so moderate level given to that patient was a given prescription that may often lead to side effect. Therefore, the code level range will be 99204 or 99214. It is based on the type of patient, whether it is a new or established. Now moving to our final case for the outpatient E&M, that is level 5. So here the patient is 65-year-old with CHF, diabetes mellitus, hypertension, present with the leg swelling and the arrhythmia that began 4 days ago. Patient indicates there is a pain in the leg. The patient is feeling very sick and is unable to provide a history. The patient's daughter is called and indicates that the patient has had fever, malaise, and severe leg pain. Physical examination indicates the patient who appears very sick and has leg arrhythmia and severe tenderness. The patient has no allergies. Vital signs reveal hypotension and tachycardia. Review of system reviewed completely. History reviewed completely. And the assessment plan, the decision is made to send patient to emergency room for the hospitalization and emergent surgical evolution for possible necrotizing facilities. CBC, CMP and blood cultures are ordered. It is recommended that the patient is starting on IV vancomycin and the piperacillin tazobactam with the vancomycin level monitoring. The case is discussed with the emergency room provider and the surgical attending physician. The patient is transported to the ER for admission. Now have a look on the audit tool. The medical decision making for this case is at the highest level given that the patient has very complex problem, necrotizing facilities that could threaten to life or body function. The data reviewed is now more complicated in the nature, involves speaking with the independent historian that the patient's daughter, ordering a test and discussion with the emergency physician and the other attending physician. The risk has now increased to high level given the patient needs to be hospitalized and is started on IV antibiotics, and there is a consideration of emergency surgery. Therefore, the code level 99205 or 99215 is indicated. If you found pleasure in watching this captivating video, I am thrilled to announce that there is a more extraordinary content like this waiting your intelligence. I am eagerly welcome your feedback in the comment section, encouraging me. Don't miss the chance to show your appreciation by giving this video a thumbs up, subscribing to my channel, and activating the notification bell to stay updated with my latest release. Thank you so much for watching this video.